Start sharing my screen if that's okay.
Please
And
do.
then we'll do the introductions because now I have to find the PowerPoint. Go. Bobby, if you could let me know when you guys can see the PowerPoint.
Sure will. Not quite. There we go.
Okay. So welcome everyone. Thank you for attending this session. I know it's a big topic for 15 minutes, but we're going to try to get through what we feel is some critical pointers for anyone across systems working with youth who are transitioning to independent. My name is Angela Riviere. I'm the director of Youth Move Ohio. You may have seen me on here before. My lived experience, my work experience is working with homeless and transitional youth. For 25 years, I have worked across systems. For a large number of those years was primarily focused on youth exiting systems and into homelessness with the view of preventing and ending homelessness in both policy and direct service. And with me today is Gina Patterson, and I'm going to let her introduce herself.
Good morning, everyone. Thank you for allowing us to be present with you guys today. I am currently the property manager for a permanent supportive housing project for transitional age youth with Community Housing Network here in Columbus, Ohio. This model has been open for 5 months now. Prior to this, I spent 10 years at the Star House, a drop-in center for youth here in Columbus who were experiencing homelessness. And prior to that, I spent 10 years in a couple different roles at the YWCA Family Center, which at the time was our front door for homeless families here in Franklin County.
So Gina and I talked about what could we accomplish in 15 minutes, and we thought we would, instead of trying to go through like specific housing models because they vary so much from system to system and community to community, is to look at what youth really need to be successful in those programs. So we're going to do a brief on a case study and then look at myths, realities, and barriers, and then talk about what things to consider when you're placing youth into housing, and also recommendations on how to help them be successful when you're managing youth housing as part of their case. So the first one real quick is, and with Gina and I will give away the secret that we're sisters if people don't know us. We did grow up somewhat together and somewhat apart, being both transitional, homeless, and in foster care. So we have vast and very different lived experience in all of those realms. From that, we have worked together over the years with youth, and those youth that we worked at, things that we have found from those youth is that these are primarily, you've probably seen them across anything that you work with, but these are what youth have identified directly to us. So they need stability, and what we're going to focus on obviously is the stability in safe housing, but also these other components of trauma treatment, consistent adult goal setting, and positive peer supports in order to be stable. So our case study involves a youth that we're going to call Robert. It's not his real name, just FYI, that we both have worked with. This youth was multi-system, lifelong multi-system involved, actually aged out of the juvenile justice system. When he aged out, the system was really good about establishing him an income through Social Security disability benefits. However, the other parts were less stable, although there was a plan to engage back into family members for housing and a referral to mental health services. This was not really a stable environment in the family because there were like long-term family issues and a lot of people living in a household. So he went from having like 24-hour support on what to eat, when to sleep, tutoring for school, mental health treatment, people giving him his medications on time, to a completely chaotic environment, which caused him to be homeless. And those, eventually, working with Gina in the drop-in center, Gina and I worked with a friend to kind of pull strings to get him into housing, but housing wasn't the whole being. Her and I still have contact with this youth over a period of number of years, just running into him in the community and checking in. And it took a lot of community support long-term, both formal and informal, including peer support. Gina, is there anything you want to add about this particular situation? Maybe the brother issue?
Well, I just want to, and I want to be mindful of our time this morning. There was something that you hit on that is not uncommon, right? The goal is the successful exit plan made to put them back in the place that put them at risk to begin with, which happened with this, Robert. And then to hit on what you said, informal support is very important. The professional support definitely as well. But when we're talking about youth who feel like they've been case managed to death, that peer support and informal support, we probably, in our community, we certainly could improve that considerably because it's very important.
So these are the primary myths Gina and I discussed. Like, the first thing everyone says to us when we're in meetings over the years is, get them an income, get them a job. But you have to consider these youth are not prepared to successfully manage a job. And the other myth that youth get told is once you get housing, you're stable. And the other myth that we see is if you get treatment, you have no problem. So go to counseling and you're fixed. While all these things are important, it's important to identify that these are really myths. There's a lot of years of undoing trauma. There's a lot of years of learning how to be housing stable and maintaining housing. And there's a lot that needs to go into a job. Gina?
And the thing about the job, and I won't expand upon it too much, I always say I have stable resources and I'm, definitely old enough, but still sometimes it's hard for me to get to work. Why would we expect people that are living pillar to post to be able to sustain and maintain? As well as I think there should be a bigger push for trauma-informed care workforce development.
So I'm trying to get to the next slide. So the reality is there's a lot of issues and barriers, and some of them maybe we see outright or some of them we need to consider. Culture, education, their skill set, trauma triggers. Everyone has unique trauma triggers, communication, expectations, and regulations. And if you were going to do an intake, we really want to hit on
You're nice and close. You're only like 2 miles away.
Yeah, I'm super close. I love where I live. It's so
I
convenient
don't know who's
to everything.
It is. That was one of my big things, and I was.
Somebody accidentally unmuted. I'm sorry about that. So anyway, Gina, do you want to pick which ones you think? I think some of these are built into case plans and exiting plans when youth are leaving systems, but I think some of them we might overlook or go through too quickly, and that can also cause youth not to be stable once they are actually housed.
And I'm going to reserve comments because the next slides will talk a little bit more about defining culture, right? Not taking for granted who their supports are, even if they are less than an ideal candidate that we would prefer to be. And then the expectations, again, later in the slides, we'll talk about the differences between maybe drop-in services, transitional living program versus an actual lease.
So one of the things when we're talking about culture that we try to think about, especially if you're working on youth, and not just homeless youth, but youth who have been disconnected from their families, whether that's through juvenile justice or through foster care, is that over time youth develop these skills. Some might sound negative, but they really have been about protecting themselves. And we need to recognize and value them and help the youth turn them into productive life skills. So they have strength, they have independence, self-reliance, but they also have to use manipulation sometimes to get themselves out of bad situations. They're creative, they can problem solve outside of the box. So we have to look at our boxes and make sure they match what their skills are creatively. They have to protect themselves mentally and physically, and that might not be traditional ways. They might seem to have a lot of arrogance and self-confidence, but that's really protecting them from their vulnerabilities. And they're able to manage an enormous amount of stress, and that gives them adrenaline and drive. So if you're able to really value these and turn them into productive skills, that could help the youth be successful. Gina, do you have anything to add on this one?
I wanted to talk about the self-reliance and manipulation. So when we're usually dealing with a young person, the first thing we want to say is calm down, or no, that's not how you're supposed to behave. I always say it just depends on how you package it, because manipulation could also mean resourcefulness, right? Whatever kept them alive and enough doggedness to get here today, it was a survival skill. So it was really resourcefulness. We're just going to teach them different ways to apply that resourcefulness.
And I think that's the biggest one. Like, I always put this on my list because
That's all, Angela.
I think people, like what Gina's saying, I think people overlook and they take manipulation as a bad skill and a negative, and it makes them somehow not a trustworthy person. But once you get it over your personal cultural bias about what these things are and how they reflect on the youth that you're serving, it can help them to actually communicate what it is that they're needing to be successful if you look at it in a different way. So, Gina, I don't know if you want to go through this, if you want to just go through these bullet points and add stuff, because I know you have a lot to add to this slide particularly. Did you get it?
You're breaking up.
Oh, I'm sorry. Can you guys hear me anymore? Is that better? Okay, so we'll just go through each of these bullet points, Gina, and you could just add, like working with youth to determine what success looks like to them. So do you want to just go through this slide? They can pretty much read it.
Yes. The first bulletin, bullet I like to expand upon about that is about, sometimes we will say, oh, there's an opening and we have a young person in need, so let's just make them fit into that housing model, versus really getting and sitting down and talking to that youth, figuring out what their supports is. For example, maybe someone isn't comfortable living in a secure building because of trauma, right? They don't want 40 other people when they walk down the hall in the morning to check their mail to be present, because that could be inflicting more trauma, right? So really taking the time to talk with these young people about what the model of housing is and educating them about the expectations. You want me to do the next one?
Yeah, go ahead.
Okay. Well, and when I believe what you mean by the full assessment beyond eligibility, excuse me, is going a little more in depth. Sometimes who they're presenting might be not be the only person that they feel like they're responsible for. So we might put a young person into a housing situation not knowing that they have two younger siblings that they're going to be sneaking into housing because they don't have the proper resources. So digging a little deeper to see what's important to them and who truly is in their life, because that could also become a burden for them. A lot of times they feel a whole lot of stress and responsibility for things they shouldn't be, but they have been managing that. And we might not find that out until after they're putting their housing at risk.
So also, I'm going to say one more thing about this slide. I think we have 2 more minutes left according to my stopwatch. I can't hear you, Bobby, but that's fine.
Angela,
I
your
can't hear
volume
you.
just decreased immensely.
We just lost volume. Oh no. Gina, can you
I can
guys
hear
me
you.
If I yell? If I yell really loud,
I can hear you now. Yelling doesn't seem to do it. Something muted you, only partially though. Go to the little up arrow next to your microphone and make sure that it's still on. Okay, Angela, I'm going to suggest that you jump off and right back in, which means we're going to lose our PowerPoint. So let me pull it up.
over the recommendations and we're fine. This is the last slide.
Okay.
Can she hear me? She can't
Do you want me to go over some? I mean, some of them we've already talked about.
Yes, Gina, please.
Okay. We talked about providing culture competent programming. Again, that's not what we as a provider think that culture is, but really being in tune with the youth, and again, spending time with them to know what those are. And understanding that they're not going to be forthcoming at first, right? Just because you ask them one time, right? These are young people that are looking at adults like, wait a minute, you want me to trust you when the same people that were thought to protect me are the ones that put me at risk. Set clear understanding of legal requirements. For me, I've been in this property management now for 5 months, and what I'm seeing coming from drop-in services and shelter services is there's a big swing between transitional living program and signing an official lease. Like Angela said earlier, it's so overwhelming to go from a system of care that is managing everything, including your hygiene items, to all of a sudden you have this property manager that's holding you liable to all these lease expectations. Angela, are you available? I don't know if it's working, because I would like you to talk about the peer support. Can we hear you?
Is it working or no? If it's not working, we're out of time anyway. Just hit a couple more, Gina.
Okay, then the thing that Angela is the expert on the peer support, and I'm still learning. But one thing we would like to say is just because they've reached a benchmark in some data reporting subset that we have to do for funders, that doesn't mean that they still don't need that reach out to them. So long-term supports with no expectations, just, hey, how are you doing? How are things going? I don't need anything from you. You don't have to fill out anything. I want to know that you're okay. Thank you all. I know this was a very condensed, very limited. And Angela, thank you so much for inviting me to participate.
Well, despite the technical difficulties that Angela had just in the last 2 slides, that was excellent information. I think it struck home for many of us. I saw Sugar out there nodding her head along with me. So thank you very much for that. Do not for 1 minute think that that wasn't successful. Great information. And you know, Angela, what we might do, and I'll talk with Kara about it, is have you come back and record the end of it with being able to hear you, and add that onto the end of this recording, or add it there so people can hear your input on that, because we store these and